Alright, good morning and happy World Kidney Day to all of us. I hope you're hearing me loud and clear because I don't want this to be like the last presentation we had that people complain of my voice not being loud. So today actually want us to be able to hear me loud and clear as we talk about our kidney health. Okay, today is World Kidney Day and the title is Kidney Health for All. Okay, I'll be going after this presentation online. I will also be going out into the streets to talk to people about their kidney health. So, if you're lucky today, you're staying around Abakaliki, you will see me in the streets talking to people as much as I can, one on one, about their kidney health. So, and after that, I'll also be giving out this um, um, pamphlet or this small book you're seeing. It's actually talking about um, is your kidney failing, trying to raise awareness about kidney health. So as much people I'm going to meet today, I'll be giving them this book and it's going to be for free. Okay, so you can also support us to be able to give out this book. And this book has a lot of important content. We'll be talking about what your kidney is, the nephron, the functions of the kidney, then what kidney failure is, the signs and symptoms of kidney failure. Everything we are going to be talking about in this presentation today is already captured in this book. So we'll be giving it trying to raise awareness so that people will actually know that a condition like kidney failure actually exists. And it doesn't care about your class, it doesn't care about who you are, it doesn't care about your social strata in the community. It affects and it hits everybody. So that is the reason why we are live today to actually help educate those of us who may not really be able to come in contact with one on one so that you also benefit from this knowledge. Okay, so we're talking about kidney. All of us we have something called kidney, and the kidney is located at our in the peritoneum. The peritoneum is just like the peritoneum is around everything around this part of the body. Okay, so now look at the position of your kidney. Okay, I don't know if you saw what I did. Alright, so that is actually the position of our kidney. That is why most of the times when you are having kidney pain, the kidney is actually an abdominal organ, but when you are having kidney pain or kidney related pain, you will discover that this pain you are having, the pain is usually what? At the back. If you are a member of my kidney health class, you have heard me talk about this kidney pain over and over again. It's actually lower back pain is one of the signs of something is happening to your kidney. So this is because of the location of the kidney. So normally everybody God created has two kidneys. Okay, one on either side of the vertebra. So we have the vertebra one, we have the vertebra right vertebra sorry, right kidney and left kidney. So we have right and left kidney. Every normal human being God created has two kidneys. And these two kidneys is supposed to be located at the point I just showed to us. Okay, so we have cases where people are giving birth to and the kidneys are no longer in that position where they are. We call them ectopic kidneys. Okay, so ectopic kidney like when kidney is formed and is not in the position where the kidney is supposed to be. Some of them to be in the pelvic region, making this person prone to repeated attack of infection. And if the two kidneys are ectopic, it means that kidney failure may actually happen at any moment. Okay, so now I've talked about ectopic kidney. There are some cases also when this person may never be born with just one kidney. Okay, we have also in cases where someone will be born without kidneys at all. So you have cases where this person can be born with just one kidney. So when this person is born with one kidney, okay, is born with one kidney, it means that this person can actually live a full-fledged life, live as long as God wants them to live with just one kidney. We call it renal agenesis. So someone can actually live with just one kidney. Okay, having said that, and I hope we are understanding what I'm saying, someone who is born with one kidney can actually live as long as God actually destined them to live. Okay, when that happens, this one kidney that this person have will actually if you wait with someone who has two kidneys, that one kidney will actually weigh double that size. So, and actually most people are actually born with one kidney, but they wouldn't know until something happens and they go to the hospital and they run a scan. Okay, and maybe with that scan they'll be able to know that this is what is happening to their body. So I want to use this opportunity to tell you that we in Vicnovus Medical and Kidney Care Services, we now run an up-to-date scan, like a scan that will actually show you the position of your kidneys and where they are and how well they are doing and if there's anything wrong with them. Okay, you know I'm a kidney health coach, so we have this particular interest in detecting kidney issues. Okay, in detecting any abnormality, structural abnormality in the kidney using our scan. So from next week, our scan center will begin to function optimally. So I'm urging you to visit us and get a good medical experience, because one of the reasons why most people die before their diagnosis is being um, noticed or is being given or is being gotten or is being discovered is because of wrong being managed by wrong not getting the diagnosis on time due to one thing or the other. So because of that, we're trying to bridge this gap. That is why we are bringing in our own ultrasound machine, so that when people who have conditions, maybe you have a lower back pain, and most of the time you go to different labs, different scan centers, they give you different readings. Someone will give you stone of 2 mm, another will give you stone of 3 mm, or someone will give you kidney cyst, another will give you kidney stone, and you're not even particular about what is actually happening. So we are here right now to actually bring a bridge to that deficiency, so that by the time you give you a result and tell you that this is actually what this result is, and that is what this result is. And the team we have here working with us in this scan is they are all core professionals. Okay, so very soon we'll be talking about them, maybe bringing them live in the show to also educate us on things we need to know. But I want to tell you that we are core professionals, and if you're around this vicinity, Abakaliki, Ebonyi State, I will want you to visit us. Then even if you are staying around and maybe Enugu, Owerri, Umuahia, or Asaba, anywhere you are, you can actually come, because your health is your life. How long you live on earth is determined by your health, So I'm not here to talk about the scan center, but I just wanted to bring it up because of the things we are discussing. So right now, thanks everyone for joining us. Okay, once again, I welcome you to this very live broadcast. You can see that I'm actually rushing. I'm rushing because I want it to be as snappy as possible, because we are going into the street also to talk about this same thing we're talking about here. So we've talked about the kidney. So now we've talked about the formation and the abnormalities that can, some of the abnormalities that can be seen at birth when someone is having kidney that will actually predispose someone to have kidney issues when the person is born. We talk about renal agenesis, we talk about ectopic kidney, we talk about a whole lot. So now we'll talk about the complete absence of kidney. Yes, some people can actually be born without no kidneys at all. Okay, we've had and people born like that with them, they are not compatible with life. Okay, some of them die within few minutes or few hours of coming into the earth. So having said that, what is the kidney? The kidney is actually a bean-shaped organ. Bean-shaped organ means that the kidney has the shape of a bean. Okay, it has the shape of a bean, and like I said, it's two. Is in a normal setting, a normal human being, in a normal condition, it's supposed to be two in the body. So it actually helps, and is reddish brown in color. It actually helps to filter blood, remove excess waste, remove excess fluid, control blood sugar. Yes, it has a role that is plays in controlling of sugar level. It also plays a very serious role in controlling blood pressure and blood level. Okay, these are the functions of what the kidney does for you. So then it also plays a very important role in vitamin D production, okay, in making vitamin D available for the body. And it also has this great correlationship with bone health. So how healthy your bone is also a functionality of your kidney. Okay, I know that you've not heard me talk about this even in my normal kidney health class. That is why this is actually a very special broadcast that I'm going to be revealing a lot of things. That's why I'm urging everyone who is listening to actually stick to the end. Okay, so now we've talked about this. We've talked about the function of the kidney. I will say one of the chief functions of the kidney is to remove waste product from the body, lipid waste product from the body. And one other function of the kidney also is to remove excess fluid. Okay, these are the things that on a normal day you know that this is what your kidney does. So there's also another work that your kidney does. Your kidney has something that is called erythropoietin that it produces. It's actually a hormone. Okay, so this hormone that the kidney actually produces helps the bone marrow to produce red blood cells. That is why when someone is having kidney issues, you discover that this person, because the production of erythropoietin will be reduced if not absent. Because of that, this person will have a lot of issues with blood percentage. That is why if you see people who are on dialysis, they are always needing blood. Okay, this answers that question. Then the kidney also controls blood pressure. Okay, so it's actually very important for me to state in this video. It's also very important for me to state in this video that the kidney also controls blood pressure. Okay, it controls blood pressure through a system known as RAS. Okay, through a system known as RAS. So that is why we have something we call um, angiotensin that actually helps this to happen. So um, high blood pressure can cause kidney failure, and kidney failure, high blood pressure is also one of the cardinal signs of um, of kidney failure. Okay, so if someone is having kidney failure, one of the things that is common among them is that their BP is usually high. So if you know someone who has high kidney failure, you see that this person's blood pressure is very high. It's not something that is, okay. I saw a woman in the unit when we were handling the hypertensive crisis of the son who has kidney failure, who is on dialysis. So when we were trying to manage it, the woman came in and was like scolding the child. What are you thinking that your blood pressure is going high? You know, someone who is on dialysis is not the thinking that is actually causing the blood pressure to go high. What is actually causing the blood pressure to go high is because there's a distortion in the RAS mechanism that the kidney is supposed to be doing. I don't know if I'm clear. Please, I'm trying to make sure that the audio is very fantastic. Please bear with me and hear me very, very well. So these are primarily the functions of the functions of the kidney. Okay, so now there's a unit in the kidney called nephron. Okay, the nephron is actually the part of the kidney that performs the actual work. So the kidney has a lot of function, but the actual work, the unit that does it is the nephron. So that is why the nephron is called the functional unit of the kidney. That it is that part of the kidney that does the work that we are talking about. Okay, the filtration of waste from the body, the removing of the excess fluid from the body, all the mechanism all the things we've been talking about, that this is the function of the kidney. The nephron plays a very large role in this stuff we are talking about. So now, okay, we've talked about this. Now we want to talk about what is kidney failure. Okay, kidney failure happens when the kidney is no longer able to perform its function. So when the kidney is no longer able to perform the functions of all these things that we've talked about, that is when we know that someone's kidney has done what? Has failed. Okay, so the kidney can no longer remove waste, the kidney can no longer regulate fluid, the kidney can no longer regulate blood pressure or blood level normally the way it is supposed to be done. So, and it's also very important that I tell us here, that I've been saying it in the group, so but it's also very important I say it here, that the kidney will not give you a sign that it is failing until about 90% of the kidney has been destroyed. This is why it's also very, very important for us to go for regular health check. So I want us to use this medium or this period of World Kidney Day to go to the lab and do what we call kidney function test. Okay, so just do the kidney function test and send it to me, and I will be in a position to explain the results to you. Okay, so I'm giving this grace in this month of March. I didn't plan for this, but from today to the end of March, if you bring any kidney function test result, I'm going to explain it for you. So you can do that. So I've explained kidney failure for you, and it's also important that we know that there's something called chronic kidney disease. So chronic kidney disease means that this kidney disease have lasted for a period longer than 3 months. Have lasted for a very long period. So we have what we call acute kidney injury, and we have what kidney disease is actually divided into two. We have acute kidney injury, and we have um, what we call chronic kidney disease. So acute kidney injury may be happens suddenly, okay, and this person may actually survive, may actually come out from it if properly handled. Okay, some people have this condition during pregnancy, accident, when in the hospital, you can develop all those things. So AKI, acute kidney injury, can actually happen suddenly, and this person recovers from it with proper care. So chronic means that it has started and it will take a longer time, like it's progressive. Okay, now let's talk about this chronic kidney disease. Chronic kidney disease have 5 distinct stages. We have stage 1 CKD, we have stage 2, stage 3, stage 4, and stage 5. So this kidney failure we are talking about is actually in the stage 5. Okay, so and it is this stage 5 that is actually known as end stage renal disease. There's what we call these measurements, these parameters. Okay, so the GFR. So when the GFR is less than 15, that is when we say that this condition has entered into end stage renal disease, and that is what people know popularly as kidney failure. So some people they don't usually know when it is stage 1, stage 2, stage 3, stage 4, or until it has entered stage 5. And when it is even stage 2, stage 3, and you're telling somebody, especially a typical Nigerian, he will say, God forbid, and it's not my portion. I tell people that God forbid and it's not my portion is not a preventive measure. If it's not your portion, whose portion is it? Do you think it's the portion of those people who are currently receiving dialysis? Do you think they don't have a personal relationship with God? Do you think they are not covenanted children? So this thing happens. Our health is actually has a spiritual aspect, but most of the time we also have a part to play. So God forbid, and it's not my portion, is not a preventive measure. Okay, you have to do something to actually help yourself not to get to that condition. While you're doing it, also there's a place of prayer too. Okay, I believe in prayer, I believe in God, that God answers prayer, I believe all those things. So while you're doing that, you also have your own part to play. Okay, so now we've talked about this. Now let's go into the main issue, the main reason why we are here. What are the causes? What is the cause of kidney failure? So now, generally in the world, the leading cause of kidney failure in the world is diabetes. Okay, no condition have been able to remove diabetes from this over the years. Since I've entered nephrology, it has been diabetes, diabetes, diabetes. So if you know someone who has diabetes, tell the person to always go for health kidney function test at least every 6 months. So for you that you don't have diabetes, it is expected that at least once a year you go for kidney function test. But for someone who has diabetes, twice a year. So depending if you manage the diabetes, that's every 6 months. If you manage the diabetes for more than 5 years, you can actually go more regular than 2 times a year. Okay, this is because diabetes can actually hit the kidney, and also some orthodox management of diabetes can also pose danger to the kidney. So the second leading cause of kidney failure in the world is high blood pressure. So and in Africa here, we are prone, high blood pressure is actually the leading cause of kidney failure in Africa. So now, why do we have that in Africa? See, one of the reasons is because of our diet. Okay, most of the food that we eat, they are being preserved with salt. Most of us we go to the market to buy crayfish that we use to cook for our family. How is that crayfish stored? There's a good quantity of salt in it. Look at stockfish. I can go on and mention. So there is always salt in everything. So and now when doing when drinking gari, I drink gari too. A lot of us drink gari. Some people want to add salt, and some people want to eat yam. After even putting salt in the yam they are eating, they also like they want to especially the Igbo people that used to do New Yam festival. After adding the oil, some of them will also put raw salt in it. And when they put raw salt in it, they dig it into the yam and they eat it, thereby increasing the salt in their system. And there's something that the salt does for you. See, when you put when we were in secondary school, they taught us in class that salt has affinity for water. Okay, and over the years that has proven to be true. When you bring out salt and put it under the expose it to the atmosphere, this salt attracts moisture, it attracts water. Before you know it becomes wet. Have you asked yourself where is water coming from? That same thing that happens outside is the same thing that happens right inside our body. When you take in salt, something that contains salt, or taking raw salt, or maybe they bring food for you and you feel like there's no enough salt, and you're adding extra table salt to the salt you're taking already, look at what's going to happen. Just like the way it happens, it attracts water. It will attract water to it. As it attracting water to it, it is also making you feel tasty. And you keep drinking more water to compensate the taste. The taste will keep coming, and by the time it keeps coming, the volume of your blood increases. And by the time the volume of the blood increases, it gives a lot of work to the heart. And by the time it gives a lot of work to the heart, by the time it gives a lot of work to the heart, what happens? What happens? You discover that this person's blood pressure gradually begins to build up over time. And by the time this person now have high blood pressure, they now tell this person to cut down on salt. Or there are some radical stages to get to. The doctor will now become very, very radical and say remove salt from your diet. And this person will now say, if I don't put salt, how am I going to know the taste of what I'm eating? You know, it's going to be tasteless. So another thing that can actually cause kidney failure is old age. Okay, it's actually noted that from age 35 to 40, there's usually a decline in the GFR of a normal human being. So most people can actually go through old age and without anything, but old age can actually be a contributing factor because old age actually comes with a lot of illnesses. Okay, for a man, old age can actually come with prostrate. You know what issue of prostrate? What happens during post-rate, it can get so enlarged that it will prevent urine from flowing out, and by so doing, urinary tract infection, kidney infection, it can actually hit the kidney so hard. And this person may also have other complicated other health issues like diabetes or hypertension that can actually land this person to this condition. So now we're talking about urinary tract infection on its own, if not properly handled. That is why it is actually good when you notice that you're having infection or whatsoever it is, you go for health check. You go to the hospital and do urine culture test. It won't cost you much to do urine culture test. And because like sometimes people don't like going for tests. Someone said if they go for test that their mind will fly. I think it's better to know your condition and be able to handle it on time than allowing it to become complicated when you can no longer do anything about it. Then another reason why kidneys fail is because of poor dosing of drugs. So some people take drugs that are not properly dosed. Okay, some people go to the hospital, go to the pharmacy on self-medication, go to you know, because this is the drug that the doctor gave to you when you were sick, and now you feel that someone close to you is having the same condition, or in life, or later in the year, you're having the same condition, you're now going back to buy those drugs for yourself. So you're actually predisposing yourself to poorly dosing drugs. Okay, so then other things, drug abuse. Those of us that abuse certain drugs a lot. Some of us abuse a lot of drugs. If you abuse non-steroidal anti-inflammatory drugs known as NSAID, NSAID are the drugs like aspirin, ibuprofen, and this like when you abuse these drugs, it's actually going to hit the kidney, and this person may actually come down with kidney failure. So, and also some antibiotics that we take, antibiotics like gentamicin, streptomycin, okay, okay, glycosidamides, okay, they can actually cause this condition. So now let's move over to the next point, genetic factors. A lot of genetic factors can actually hit so hard on the kidney. Okay, a lot of genetic factors can actually hit so hard on the kidney. So those genetic factors is SLE, systemic lupus, can actually hit the kidney. We have polycystic. I think we did a live video last time about kidney cyst. So if you're here, you missed that live section, I want you to go back and watch this video So polycystic kidney disease is actually one of the hereditary kidney diseases. So, and we also discussed very, very well how this condition can be handled so it doesn't get into kidney failure. So you see, I think that's the last live video I did before this one. So you can actually go and watch that video. They will have lifestyle. You have lifestyle of smoking. If you're a deep smoker, after you consume alcohol in large quantities, so you have the habit of adding table salt to the food you're eating already, just like we discussed before. You are predisposing yourself to kidney failure. So we have other health occupational hazard. Working in a place where we have a lot of harmful chemicals can actually damage your kidney. Then we have sickle cell anemia. Okay, those who have sickle cell anemia, 1 out in 10 sickle cell patients, one of them will actually develop kidney failure. So it's actually, if you have sickle cell anemia, it's actually very important to watch out for this condition. So please, if you have any question, you can drop the question in the WhatsApp group. Okay, after this presentation, I'll be going to the WhatsApp group to take questions. And you can also, by the time this video is available, is uploaded, you can also ask your question. But if I ask you to ask your question right now in this video, this live video, you may not really get it by the time we upload this video, so I may not really be able to answer. So it's best for you to ask it in the group. So now, other causes of this, we have kidney stones. Stones in the kidney, if not properly handled, can actually cause kidney failure. We have benign prostate hypertrophy, that's prostate issue. We have burns and sepsis. We have transfusion reaction in the hospital. Then we have trauma. There is maybe in cases of accident or thereabout. So we have a lot of things, apart from what I mentioned, we have a lot of other things that can actually cause this kidney to fail. So, but there's something I want us to know. I have a book where I took out my time to explain that to you. If you're in kidney health class, you have gotten that book, Kidney Health Guide. I want you to take today to go through that book. Then if you've not gotten that book, I'll be sharing the link in the comment section where this video uploads, so that it will be easier for you to actually go to Seller. It's actually a safe site and download this ebook. I'll also be uploading the site where you can actually download the ebook in our WhatsApp in all the WhatsApp classes, even on Facebook. So you can actually go there and actually download this book and you'll be fine. So now, what are the symptoms? What will you see? And you know that someone has kidney failure. So I would like to start from the early signs, because it's actually very important that we note these signs early and we start doing something about it. So one of the early signs you're going to be seeing if you have kidney failure, or if someone you know is having kidney failure, is that there's this early morning swelling of the eyes. Okay, like the early morning the eyes swells up, and during the daytime it goes down. The same thing happens to the leg. Early morning it swells, it goes up, and later in the day it goes back. So when you start seeing this, or you start seeing this in a person, you know that this is actually very, very nice and very, very urgent for you to take this person to the hospital to know what actually is happening to their kidneys. It may not be kidney, but it is one of the early signs that someone who has kidney issues will actually see. Okay, so this happens, swelling of the legs, ankle, all those things, eyelid. Okay, so I know of someone, a friend's brother, and he's so rest in peace. So when the case was so bad, then they brought him to me. So by the time we started talking, so he was telling me that when the thing started, when he started sweating, well, he felt that because he traveled, then it can also happen when someone travels. I have a video where I explained that too. So he felt that he traveled. Then at another point, he felt like, maybe because I've not exercised a very long time, he started exercising. And when this also happened, he went into a lot of herbal concussions. Okay, before you know it, the thing fell drastically. And by the time he got to me and the diagnosis of kidney failure was made, it was damn too late. And we lost him after some time. So the amount of urine the person passes in a day may either reduce or increase. So these are the two things that can happen. By the time you start passing urine frequently, it may not be due to diabetes. It may also be due to kidney failure or kidney issue, or any kidney damage or kidney damage that is progressing. So difficulty in breathing and accumulation of fluid in the lung may set in. This person gets easily tired due to accumulation of waste product and due to low blood level. So because of food accumulation, it's affecting this person's stomach. There will be feeling of fullness. That's why some of them will have appetite to eat, and also feeling of vomiting because of the presence of urea, and gastritis, which is common when the urea also is high. So blood pressure becomes uncontrollable high because of renin. Okay, we talked about that. This person's skin becomes dry and itchy. There are difficulty in sleeping coupled with muscle cramps. We have this person may actually become cold when others are feeling warm. Then then there's this foamy urine. So and also I've done a video where I try to clarify different types of conditions where you notice foamy urine. So if you're new to my YouTube channel, I want you to go back. We have a lot of interesting videos on kidney health that can actually help you. And if you've not subscribed, please do well to subscribe to the YouTube channel. So we have cough and financial sputum, we have hiccups and abdominal upset, we have cessation of menstruation for women. Okay, for a woman there may be cessation, and for a man there may be a certain level of erectile dysfunction. So, and there's usually muscle cramps. So having stated this, I'm trying to rush because our time is fast spent. This is morning hours, so that we can actually go back to our work, having gained this knowledge and spread the news around. So now we have how to prevent kidney failure. So now, how do you prevent kidney failure? Remember that I will not be able to dish out everything about kidney in this one video, in this one live section. So that is why I wrote a book, Kidney Health Guide. So that book goes for 5,000 naira for the soft copy. So, but from now till um, end of March, the book will be going for 1,500. So you can actually download that ebook and read. It's actually going to help you very, very well. Okay? It's actually going to help you. You can actually buy and print it out and keep for reference whenever you want. You can go back to it. So now, I'm giving you that permission, but don't pirate it. Don't copy to copy it and sell. The law is watching you. So now, how to prevent kidney failure? So now we talked about a lot of things about kidney failure, how bad it is. So now, how do we prevent kidney failure? Number one is if you have diabetes, please make sure you manage your diabetes very, very well. Keep it within reach. And if diabetes runs in your family, please make sure it doesn't run in you because it's actually highly preventable. Okay, especially certain type of diabetes is preventable. So if you're hypertensive, ensure that your blood pressure level is at minimal range. Don't let it get high because if it keeps going high, it keeps hitting the kidney, and before it over the years, it may not degenerate to form kidney failure. So because kidney failure, that day someone starts seeing the signs and symptoms, it's not that day started. It has started a long time ago. So if you have limit and stop alcohol consumption. If you smoke and you drink, please do stop because it actually affects your kidney. So you also learn how to exercise. Engage in active exercise at least 5 to 30 minutes every day. So avoid taking drugs that are not prescribed and do not abuse drugs. If you are among those who abuse intake cocaine, Indian, it's actually very important that you stop. So stay away from herbal and polydose drugs. They can actually overburden your kidney. There are some herbal drugs that actually toxins for you. I know that we have good herbal products, but they have ones that that when you take it actually digging your grave before your time. But I believe that is not going to be our portion. So make sure you treat urinary tract infection. If you are obese, please try to cut down on your obesity, cut down on your salt intake, and also make sure that your cholesterol level is actually within range. Okay, because I used to tell people when your cholesterol is high, you don't even tell your cholesterol where to go to. Some of them may decide to go to the kidney and block the blood supply to the kidney, and by the time that happens, it hits the kidney and the kidney gets down. So if you have high cholesterol level, we have a treatment plan that can help burn down this high cholesterol. So you can actually contact me and ask me about that. So we'll be good. So now, in order to prevent kidney failure, okay, also kidney, like I said, kidney stone can also cause this. So in order to prevent kidney stone, you have to take a lot of water, okay, and exercise properly. Strenuous exercise will make you sweat. Can cause sweat a lot. because someone put me out of context, I'll make you sweat a lot. But that predisposes you to kidney failure. So when you're exercising, you exercise responsibly. So pay attention to burns and infection. If someone you have or someone you know is having burns and infection, please pay close attention to that and make sure it doesn't get infected. Make sure it's handled properly and it goes on time because it can actually affect the kidney. Okay, take more natural flavors, ginger and garlic than artificial spice. A lot of us like artificial spice a lot. So go for regular health check. So within the course of this video, I've mentioned that it's actually very important to go for regular health check. So now, every year in kidney health class, we do renal function tests, okay, to check the function of our kidney. So I want to tell us that apart from going for renal and kidney function test, it's also very important that we do urinalysis and urine culture. Then it is also very important that we go for diagnostic imaging. Diagnostic imaging like X-ray and ultrasound scan to review how structurally healthy your kidneys are. So that is why we are by next week we are opening a center where you can come in and feel like you're in your own place, where you can come in and feel the ambience of medical expertise, where your results will be accurate. Take it to London, take it to UK, US, everywhere. The results will be what it is. Okay, so we are doing something very spectacular in this place. The scan, our scan is very exceptional. So you can come into this place, do your scan, and you'll be happy that you did because when a condition is being diagnosed on time, it means that treatment and handling it wouldn't be perfect. So now we've talked about the stages and now what is the treatment available for kidney failure? Some people we have treatment available for kidney failure and it's two. Remember that treatment is not cure. Okay, we have two treatments. Treatment means that something can actually be managed. So we have two available treatments for kidney failure. One is dialysis and the other one is transplant. And both of them are both of them are okay. Both of them are good. Okay, so maybe you prepare a separate class, a separate course where we talk about dialysis and transplant. I think there was a video I did about surviving dialysis. Okay, so if you're in Nigeria or wherever you are watching this video, please make sure you scroll through my YouTube channel to get the video where I talk about dialysis. And we've not done much about transplant. I'm sorry about that. It's just coming to my notice now that all through my videos I've not even talked anything about transplant. But in a very short while, we'll be talking about transplant. So I'm Honorable Victory, and I'm the kidney health coach. So remember the things I talked about. I will be going about distributing this book. Okay, it cost me about, in present day Nigeria, 500 naira to get this published. And then it's printed out, and I'll be giving it out free in the streets today. And I'll be talking to people in the streets about kidney health. So if God lays it in your heart to support us, you can actually pay in something, 1,000 naira, 500 naira into our account and maybe put in the description to support the book that you're going around to share. Okay, so we'll be happy. So I want to actually thank you for actually joining. In fact, we had our highest number of views in today's presentation. So I want to say thank you so much for joining and for joining to the end. May God bless you. And the issues that affect the kidneys will not take your life. Okay, if you are struggling with any kidney issue, this is your time for healing. And I pray for you from the depth of my heart. My wish is not that you die in this condition. My earnest desire is that you recover. And I pray for you. May healing and speedy recovery locate you now in Jesus' name. Amen. I'm Oliver Victory, and I'm the Kidney Health Coach. So don't forget to reach out to me when you need analysis. Thanks so much for joining.